Hello everyone. This is going to be a very brief talk on why and diagnosis of ovarian cancer in young girls is missed before they are subjected to surgery, and why it is usually diagnosed in late stages in elderly females, and this is then leading to poor treatment results. Talking of young girls, if they present with a continuous lower abdominal pain or distension, or there is sudden acute onset of severe lower abdominal pain with nausea and vomiting, obviously they will be seen by their gynecologist or a local doctor and subjected to a sonographic examination. If on sonography there is a finding of ovarian cyst or an ovarian mass, the general tendency is to just get it removed immediately because the girl is young, the parents are worried. But this is how and when the cancer is missed. So at least subject this girl to an MRI pelvis, also scanning of upper abdomen and chest, and a few tumor markers, so that we rule out germ cell tumors which are happening in these young girls. If this is ruled out, we are fine, go in laparoscopically, remove the cyst and we are done. But if there is an evidence of germ cell tumor, then we have to do a surgery which involves the removal of the tumor. Not only that, we would remove all other parts where this tumor is likely to spread. But God has been kind to young girls, and germ cell tumors are unilateral, always sparing the opposite ovary and the uterus. So we need not remove that, so that the childbearing capacity of this little girl is preserved. Coming to elderly females, if they have a continuous complaint of very low grade abdominal pain, gaseous feeling, acidity, change in bladder or bowel habits, they just tend to ignore it. So they usually will come to us when their abdomens are bloated, either because of the fluid that has collected inside or because of the tumor mass. And in that scenario, they are already late, they are in stage 3 or sometimes even in stage 4. Here we then have to see that we treat them properly, and the treatment will involve both chemotherapy, 6 doses at least, as well as an extensive surgery. The surgeon would go in only after a CT scan is done and the surgeon is confident enough to remove all visible disease. But if the disease is extensive, tumor volume is high, if the disease is spread in such a way that major bowel resections are required, then it is preferred to do a biopsy from this tumor, subject these patients to a neoadjuvant chemotherapy 3 cycles, followed by again definitely an extensive surgery which removes the uterus, ovarian masses, tubes, all lymph nodes, pelvic, para-aortic, omentum is removed, extensive peritonectomy is done, splenectomy if required. So ultimately we end up with an abdomen which shows no evidence of disease to our naked eyes. But even after this type of surgeries, we have seen that 80% of these patients would recur within 2 years and the tumor comes back in the abdominal cavity. So research is then indicated that these tumors tend to come back because of the microscopic disease that was left behind. And so HIPEC came into picture. HIPEC is nothing but hyperthermic intraperitoneal chemotherapy, where a hot chemotherapeutic drug is rotated inside the abdominal cavity, which is open immediately after surgery.